Hello, everyone. I'm Whitney Ortiz, founder of Eliana's Light and Whole Health Self-Care, and the host of the Whole Health series. I am so happy to be here with Dr. Risi Idiokitas. Dr. Risi, as her patients call her, is a doctor of acupuncture and Chinese medicine. She has been specializing in pediatric acupuncture for nearly 10 years. In addition to being the founder of her private practice called Healthy Littles, Risi also is an integrative medicine specialist on the PANDA Palliative Care team at Children's National Hospital in Washington, D.C. Risi is known for helping children with life-limiting illnesses have better days. She's working to encourage more acupuncturists and more hospitals and hospice organizations to provide acupuncture for pediatric palliative care patients. Thank you, Risi, for all the work that you do and for sharing your knowledge through some key takeaways here today.
Thank you. Thank you for having me, Whitney. I'm excited to be here.
Well, to start our conversation, it would be really helpful to hear why you decided to focus on pediatric acupuncture and what may be different about using acupuncture with children as opposed to with adults.
Sure. So when I first started practicing, I did mainly treat adults and just a general practice. And then when I had children of my own and I started working with them, I realized just how incredible kids respond to acupuncture. I always share a story of my son when he was around 4, and I did a treatment on him with the intention it was at night, and just to settle him down, to try to help him to sleep better at that one night. But the treatment actually worked, yes, to help him sleep, but it extended. And I just watched in awe as for several days, he was just this, like, usually my kid who's like bouncing off the walls, who was just like really just chill and like went to sleep with no problem for many nights. And I realized just like, wow, this is amazing. And this is what I want to do. Like, I just want to treat kids. And so that's what I did. I started focusing my practice just on kids. And, the main question that people always ask me is like, how do you do acupuncture on children? And if you're familiar with treatments as an adult, then you would know that, you usually lay down and there's needles all over you sometimes, and you're expected to lay there for sometimes up to like 30 minutes. But it's completely different with kids. I always explain that time and number of needles is kind of like the dosage. So the less amount of time that needles are in is a smaller dosage. So for infants, when I'm treating infants, my hands never even leave the needle. I put it in on a point and then I just take it right back and I'm done. And then I will move on to do another point. The same thing, just in and out. So an infant treatment can be, a total of 5 minutes and then we're all done. And as children get older, that time extends and the number of needles used extends. So smaller kids don't have to lay still for some extended amount of time. And then, of course, it's needles. So that's the question, like, but it's needles. And yes, like a lot of kids are, they say, absolutely not, no way, I am not doing this acupuncture business. And that's fine, because the needles are just a tool to get to the special thing, which is the acupuncture points, which, we all have them, they're available, and they just need to be stimulated in some way. And there are so many non-needle techniques that I can use with kids if they don't want to try the needles. So I use acupressure with just pressure from my hands. I use something called toina, which is like a Chinese massage that stimulates the points. Shonishin, that's a Japanese technique that uses tools on the surface of the skin to stimulate the points. There's a lot of options, and typically after kids do get acupuncture, they love it and then like look forward to future treatment. So it's good stuff.
Yes. And you're working with oftentimes children who have complex medical conditions, very serious illnesses, including those who are in palliative care. And would you mind explaining what is palliative care and how acupuncture has been helpful within the systems management process?
Yes, absolutely. So this has become my passion in the last 5 years. When I started my pediatric acupuncture practice, I called it Healthy Littles. And this is where I was treating, healthy children who, had asthma or allergies or typical digestive ailments, sore throats, ear infections, things that typical healthy kids deal with. And then I got the opportunity to work on the palliative care team at Children's National, and that was a completely different story. So pediatric palliative care is patients who typically have a life-limiting diagnosis, and there's a really wide range as far as the palliative care journey, I guess. So I have patients who have chronic palliative care needs, and I've been seeing them for years, and I hope to continue to see them for many more years. And then I also have patients who have end-of-life palliative care needs. And this means that I'm helping them with within the whole journey, I'm helping with symptom management. As you know, Whitney, these kids with these really serious illnesses, they go through a lot, and there's just so much that they have to endure. And I've come to call my pediatric palliative care patients the bravest littles. And so being a palliative care acupuncturist, I'm helping with symptoms and helping with just quality of life. So I treat a lot of pain, a lot of nausea, anxiety, fear, patients who are having trouble sleeping, patients with lots of constipation, diarrhea, all the many symptoms that come along with a lot of these really serious illnesses. And the thing that's just, so different, if you've been to an acupuncturist, you know that acupuncturists ask 1,000 questions, because in all of our training, the goal really is to get to the root of what's going on. Like, if you're coming in for a headache, yeah, I want to treat your headache, but really I want to figure out why you're getting the headaches, and I want to treat that. Or, if you're constipated, like, yes, I want to help you poop, but I want to help you I want to figure out why you're constipated and treat that. Whereas in palliative care, it really is just symptom focused, and I'm not really asking 1,000 questions and trying to get to the root. As you said in the beginning, I'm known for helping kids with life-limiting illnesses have better days. And that's my goal, just to, address whatever symptom is happening right now. And I've embraced that my job is not to fix it as a palliative care acupuncturist. It's just to try to make it better. And acupuncture has been really successful with that. And that's why I've just come to love it. When I go in, I see a patient who has a really bad headache, and maybe they say it's an 8 out of 10, and they're getting lots of medications for it. But then at the end of acupuncture treatment, they say it's gone down to a 4 out of 10. So I didn't fix it, but I made it better for that day. Or one of the wonderful things about working in the hospital is I can see vitals when patients are hooked up to monitors, and it's not uncommon for me to be treating maybe like a baby who's really tachycardic. So their heart rate is just too high. And I'm doing a treatment, and me and other providers will just kind of watch the monitor, and in awe, really, is you can just literally watch the heart rate just come down and down and down as I'm doing a treatment. And I could go on with all the many helpful things that come out of acupuncture treatments, and how the kids really do they benefit and they ask for it. Just recently, I had a patient who she was scheduled for a really a big surgery, and she knew that when she came out of the surgery, she would probably be sedated for several days as she recovered. And she asked her mom to make sure that, even though she knew she was going to be sedated, make sure that Dr. Risi comes and gives me my acupuncture. So the kids really do love it, and they benefit.
It made such a positive difference for so many families. And there are so many other families out there who would love to have access to acupuncture and acupressure for their children who are experiencing significant challenges and hardship. In that light, you have been doing tremendous work in the advocacy space, really, to increase the access and the knowledge and raising awareness on the benefits of acupuncture and acupressure for children, and to help to eliminate the barriers that exist for people to be able to have it. Just often it's not covered by insurance, and out-of-pocket costs can be expensive and not make it doable. Also, some hospitals and traditional allopathic medicine providers are hesitant to use it. And as you shared in that example of watching the numbers change on the monitor, sometimes needing that concrete data more than the stories, the anecdotal evidence, can make a positive difference. Can you share a bit about your work in that space of advocacy, raising awareness, connecting others to these opportunities?
Yes, please. So like I said, in the last 5 years, this has become my passion. With the success that I've seen, I really strongly believe that any child who has a life-limiting illness should have access to acupuncture and Chinese medicine. And within hospitals and hospice organizations, acupuncture is just very greatly underutilized. So I've been working to encourage other acupuncturists to consider working with the bravest littles, and kind of putting themselves out there as acupuncturists who get some extra training and are willing to work with the bravest littles. But once they're willing to do the work, they need to be either, hired or contracted out and have access to the bravest littles. So I'm also trying to have other hospitals and hospice organizations make it possible. There's not many that I know of, and I always just want to give kudos to Children's National Hospital in Washington, D.C. When I started there 5 years ago, I was there very few hours as a contractor. And because of the results that they've seen, just in the, like you said, seeing that the numbers do drop, seeing the incredible positive feedback that they get from patients and patient families, and listening to myself, they've now increased the amount of time that I'm there at the hospital and brought me on as staff. And my hope is that other organizations follow their lead. And even though it's not always covered by insurance, that it does sometimes need to be an out-of-pocket expense for an organization or for a family, it's worth it. It's the value that it brings is so immense that it is worth it. And I definitely also want to say that there are acupuncturists all over the country who are working tirelessly to make sure that more insurances are covering acupuncture. Right now, there's been some advances in Medicare, but Medicaid still doesn't cover any acupuncture services. So I definitely just kind of want to send a thank you to those acupuncturists for doing that grassroots work to continuously work on that. But in the meantime, we do need more organizations, foundations like Eliana's Light, who recognize the value of integrative services and are doing what you can to try and help families get access. And again, I'm hoping to educate more hospitals, more hospices, and parents too. If parents are at an institution with their child and they want acupuncture, ask for it, right? For organizations to know that it's a wanted service, we have to ask for it. And if you ask for it once and they say, unfortunately, we don't have it, ask for it again, and then again, and then again. I've provided Whitney with a paper, an article. There's not a lot of research on the benefits of hospice and palliative care, or with pediatrics in particular. But there is one that I wanted to share, mainly because it's pretty recent, 2018. And also it's one of the few free ones that you can just read without having a subscription to a medical journal. So I encourage parents to have a look at that and share it with your medical team and let them know that, you know, this thing it's good stuff and we want it. And also, when I started at Children's, they weren't looking for me at all. I reached out to them and I convinced them that this was a service that they needed to provide to their patients. And thankfully, they listened. And so I encourage other acupuncturists to do the same. If this is a path that you think you want to take, reach out to your local hospital, reach out to your local hospices, and convince them that they need you, educate them, share this article, and just it's got to be, you know, a group effort. We've got to work together. Parents, let it be known that it's a wanted service. Acupuncturists, let it be known that you're there to provide. And we hope that hospitals and hospices will recognize the value and bring on services.
Yes, thank you. I echo everything. As you know, we are with you and with all of the acupuncturists out there who are working to increase and improve awareness on the value of acupuncture and acupressure for children, and where it is deemed to be safe and appropriate, and where it is becoming, thankfully, more welcomed within different settings, both in the hospital and at home. And thus, thank you, Dr. Risi, for all that you do and all you have done, and for the team at Children's National who have increased the opportunities for this to become more mainstreamed and available to children who spend a lot of time at Children's National. So thank you. So for those who are interested in reaching out to you, Dr. Risi, can you please share your contact information and how they may follow you as well on social media, if that's of interest?
Yeah, sure. So I would love to answer any questions from providers, other acupuncturists. I can be reached at Risi at healthylittles.com. On Instagram, I'm Dr._Risi. And acupuncturists who are interested in becoming providers for the bravest littles. I do have a course on, it's at healthylittles.thinkific.com. And I am encouraging acupuncturists to really consider getting a little bit more training so that they can do acupuncture for pediatric palliative care patients.
Thank you so much, Dr. Risi. And to all of you, if anyone has interest in receiving more of these kinds of information shares through the Whole Health series, please feel free to email info@elianaslight.org, and we will look forward to connecting with you.